This meeting is being recorded.
All right, guys. 1 second. Okay. So my name is Maura, and we're going to talk about case study number 3, which is on cancer genomics, a family condition. So this case study, just the point of view, you're a new grad nurse working in an oncology unit at your local hospital. You work for Dr. Aiken, who's a medical oncologist and a specialist in cancer genomics. And you're assigned to a patient, Lee F., a 22-year-old male patient. And Dr. Aiken performs a biopsy on a tumor-like growth on his adrenal gland. And you record the notes while Dr. Aiken takes Lee's family history. So I just broke down the family history here because the case study had it kind of all spread out. So we can see that there's 4 generations of cancer within the family, we can start with Grace, that's Lee's mom. So she was diagnosed at 44 years old with bilateral breast cancer. And then Lee's maternal uncle, which would be Grace's brother, Geoff, died at age 8 from leukemia. And then the maternal grandfather, Roger, which would be Grace's father, died at age 35 of soft tissue carcinoma. And then the maternal great-grandmother, which would be Grace's grandmother, died at age 30 of a brain tumor. So we can see 4 generations of cancer on the maternal side of Lee's family. And then I just added all the family members on the other side that don't have cancer within Lee's family. And since we're the nurse in this case study, this is what we were recording down on the medical history chart. So you have a strong feeling that there is a high incidence of cancer in Lee's family based on the 4 generations that you're seeing. So we're seeing 4 different types. We're seeing sarcoma, brain, breast, leukemia, and now potentially adrenal cancer. And you're wondering if it's caused by an inherited gene deficit. So you begin to research as the nurse genetic disorders on Genetics Home Reference, and you search autosomal dominant adrenal cancer, and you come across 7 different disorders. So you share your findings with Dr. Aiken, and Dr. Aiken expresses his concern for Lee's younger siblings, Leah and Luke. And now if I go back to the last slide, just so you can see, they both don't have any cancer, any signs of cancer within the family. And they're 16 and 12 years old. So you're worried about sharing your suspicions with Lee and Grace, the mom. Why are you, worried about sharing this? It's because Grace is still recovering from breast cancer surgery and chemotherapy. To you, Grace seems very fragile, distraught about Lee's tumor-like growth that we haven't identified yet. And if Lee does, in fact, inherit a faulty gene from Grace, the mom, this would predispose him to cancer. And you're worried how she might handle the news, especially since it would be inherited from her side of the family. So to you, Grace also seems like she's got deep feelings and is at risk for serious depression. Now, on the other hand, your feelings are that Lee seems upbeat with a good sense of humor, who wants to improve his mother's spirits, but you dread to be the one to tell him about the genetic condition. So the results come back, and Lee has inherited a gene from his mother that predisposes him to cancer, just as you had feared. The recommendation is that Leah and Luke, the younger siblings of Lee, undergo genetic testing as well. And because of all of these findings, Lee's case and the family inspire you to find out more about how to prevent this disorder. So as you're searching, you find that there's frequent screenings and checkups that need to be done in avoidance of risk factors like smoking. So now Lee's biopsy is revealed, and he is diagnosed with a cancer called adrenocortical carcinoma, also known as ACC. Dr. Aiken is on the cutting edge of developing treatment for ACC and is part of a group of researchers that are trying to catalog all different genes that may be involved in adrenal cancer. So this research that the doctor's doing will help scientists discover drugs to target specific cancer contributing gene products. So Dr. Aiken and the team use a laboratory tool called microarray to detect the most common genes that are implemented in ACC. And this microarray will analyze the gene expression and then compare it to normal tissue to see which genes are involved in this cancer. So 6 patients with ACC were analyzed, and one of them is including Lee. And just to note that it was stated in the case study that Dr. Aiken collects a consent form from Lee, checks with hospital policies, and checks with his private insurance for eligibility for genetic testing. So the gene results are in, and the result shows that Lee has a low expression of a TP53 gene. Essentially, we'll talk about this in a little bit, but this gene we all have suppresses cancer growth. So since he has a low expression of this, it's allowing the cancer to grow. And he has a germline mutation on it, which is the most common type, and it's in about 72% of cases with ACC. And this type of mutation means that there's a higher probability that it can be inherited by offspring. So right now, Lee has no children, but has expressed the desire to have children in the future. But with these new results, this definitely gives him a new perspective on the future, since he has a high risk of passing this on to his offspring. So now the nurse, you, despite trying to maintain your professional level of emotional distance, you have become very attached to Lee and his family. So you spend evenings searching the medical literature for potential treatments, including clinical trials to help them. You discover that there has been gene therapy trials involving TP53 treatment, but it has not been approved by the FDA. And the trial was stalled. The main problem with the trial was that the company developing the treatment did not provide enough evidence to the FDA to show that the treatment was effective. So regardless of the FDA not approving the clinical trial yet, you speak to Lee's family about the possibilities anyway. And the big thing is that you speak to the family about it before the doctor knows about this treatment. And this gives Lee and his family hope that the future of gene therapy will cure this disorder. So Dr. Aiken meets with the family and learns that he's been made aware of potential future clinical trials and treatment options that you shared with the family first. So then Dr. Aiken helps Grace, which is Lee's mother again, set up some appointments to learn if she is also a carrier of the TP53 mutation that we've already confirmed that Lee has, and is eligible for genetic testing. The doctor also leaves the decision up to Grace, the mother, if she wants to find out the answer or not. And then he recommends that the 2 siblings, Leah and Luke, also receive genetic testing, so preventable measures can be taken if they are positive for the TP53 gene mutation, but also leaves that up to the mom to decide this. So that's the case study. So we'll get into like the ethical dilemmas within the case study. I know we've talked a lot about these definition words, but I just threw in the definitions here to reiterate. So for non-maleficence, it's the principle to communicate the obligation to do no harm. And if you cannot do good by the patient, which would be beneficence, at least do not do any harm to the patient. So the nurse did want to help the patients by looking up research on trials to help with finding a cure for this mutation. However, it was completely out of her scope of practice. For one, it was a non-FDA trial that didn't have enough testing to prove that it would not harm the patient. And also, you can't be recommending treatment options as a nurse unless the doctor has that already in their plan of care. And then also the genetic testing would help to see if the gene would be passed along to the children so that the harm is going to the children. So for beneficence, this is, doing good by a patient. And in this case study, it was that the genetic testing for the family to see if they're carriers and how it would be expressed and passed along. And getting the siblings, Leah and Luke, also tested to see if they're carriers and if they have a cancer gene link. And for autonomy, I feel that the doctor gave the family the choice in terms of genetic testing and the concern of the genetic testing for the siblings, along with educating about the disease, the cancer, and the effects that could have on the family, and allowing each of them to make their own decisions. And for justice and fairness, which is justice is treating people equally without prejudice. I believe that the nurse was had too much of an emotional connection with Lee and the family, and the research and information given to the family about the non-FDA approved treatment was not given before the doctor spoke about it. And this is, like I said, out of her scope of practice, and also is not treating each family or patient the same due to the emotional connection. She also was giving false hope that this trial could cure cancer, knowing that it's a non-FDA approved, and that there's a hold on the treatment because there's not enough research to show if it's effective or not. So there's a lot of layers in terms of like the medical diagnoses. So for medical indications, for the principles of beneficence and non-maleficence, the first question is, what is the patient's medical problem? Is the problem acute, chronic, critical, reversible, emergent, and terminal? So Lee is diagnosed with adrenocortical carcinoma, ACC, and a low expression of TP53 gene with a germline mutation. So we'll get into kind of what those are. So ACC is a cancer of the adrenal glands, and it forms on the adrenal cortex and affects the functioning and production of hormones, which can either be an overproduction or an underproduction of hormones. The hormones are usually overproduced due to ACC is cortisol, aldosterone, testosterone, and estrogen. So this is a chronic, very rare type of cancer. And there is about one case diagnosed in 1 million people in the US, and is more common in females than males. The survival rate of ACC is definitely dependent on the stage. Within later stages of this cancer, the survival rate could be 3.21 years. So this would be considered terminal. But if it is caught early enough with combination of radiation, chemo, and surgery, ACC can be cured. So talking about the TP53 gene, so he's diagnosed with a low expression of the TP53 gene with a germline mutation. So the TP53 is a gene that we have in our body, and it plays a crucial role in preventing cancer formation. So with it being low, having a low expression, this allows that cancer to proliferate easier. And the germline mutation is the most common type within the TP53 gene. It's seen within 72% of cases in the US. And this type of mutation has a high inherited rate for the risk of certain types of cancers. So this is considered chronic because it's inherited, but it's also not detected easily. And it's only detected in about 15.7% of patients, and is associated with certain types of cancers. So I think that's how they originally traced this back to the family, by the four generations of cancer and the specific types. All right, so in what circumstances are medical treatments not indicated? So for this question, I would say that surgery is a medical treatment option, but if the patient for some reason wasn't able to have surgery, or surgery was contraindicated, they'd not be able to undergo the surgical removal of the adrenal glands. And essentially that's, from my research, the most effective way besides chemo and radiation to get rid of the cancer. And then in sum, how can this patient be benefited by medical and nursing care, and how can harm be avoided? So Lee will benefit from medical and nursing care because he was diagnosed with a rare cancer and also with an inherited gene mutation that increases the risk of cancer with the germline mutation. So he has a high probability to pass this along to his offspring. And he's mentioned that he's wanted to have children in the future. And with this new medical diagnosis, he's going to have to make some really life-changing decisions. And he can also undergo treatment for his cancer. And then there's going to be follow-up care with the healthcare team to carry out that plan of care to make sure that he reaches his end goal of bettering his health. And both the nursing care and the other healthcare professionals can assist him physically, emotionally, psychologically. All of them, yeah, okay. So for patient preferences and the principles of respect for autonomy, so the first question is, has the patient been informed of benefits and risks, understood this information, and was given consent? So Lee has been informed of the benefits risks of being diagnosed with ACC and TP53 mutation by the doctor. He's also consented to genetic testing in order to find out if he was diagnosed with the gene mutation of the TP53. And this revealed that he would be able to pass it on to his children. He does understand the information from the case study, I believe, because it states that he speaks about wanting to have children, but needs to make further life-changing decisions. So that to me makes me feel that he understood what the results of his genetic testing were. It also states that he signed informed consent for the genetic testing, and that his insurance was checked for in the hospital policy. So it seemed like the doctor was doing a thorough investigation to see if this was the right treatment option for him. And then they also talk about having the family understand that it's recommended that the siblings of Lee get tested as well, along with the mom, Grace. The only thing that I would say is out of place within the case study would be that the nurse gave information about a non-FDA approved trial option that was not part of the doctor's treatment plan, and also out of the scope of practice of the nurse. And she was overly emotionally invested in this family and wanted to help. However, this is countertransference that the nurse is practicing. So the second question is the patient mentally capable and legally competent, and is there evidence of legal incapacity? So I said that Lee is mentally capable and legally competent in understanding the information about both the diagnoses, and I do not believe that there was any evidence of legal incapacity in terms of the doctor. He is a 22-year-old male, so he can legally make his own medical decisions, but does not have to have any other diagnosis that would make him incapable. We weren't given any of that information. The only thing, it didn't go into it too much, but I feel that the nurse did speak out of, like I said, her scope of practice. However, there was no more information in terms of like any disciplinary actions or asking her to be like stepped out of the working with the family. So the third question, if mentally capable, what preferences about treatment is the patient stating? So Lee is mentally capable, as he states that he wants to go along with the genetic testing to find out if there is a genetic component to his cancer. He does find out through this that he has a low expression of the TP53 gene, which means that the cancer is proliferating from the inherited gene. And that he could be able to pass it on to his children. The case study did not mention about Lee's decisions to go forward with any surgery, chemo, or radiation that his cancer has, but I would assume from the case study and the way they described him that he would want to go ahead with these treatment options if it was spoken about. Okay, so for quality of life, for the principle of beneficence and non-maleficence and respect for autonomy, what are the prospects with or without treatment for a return to normal life, and what physical, mental, and social deficits might the patient experience even if treatment succeeds? So I said for Lee to return to normal life and to treat his cancer, the best option for him would be to follow the doctor's care plan for treatment and removal of the cancer. From researching ACC, it is a rare cancer, and depending on the stage and the progression of the cancer, it can be curable with surgical removal of the adrenal glands with a combination of chemo and radiation. But unfortunately, there is no cure to the mutation of the TP53 gene. However, following the treatment plan for the ACC cancer with the TP53 mutation, any further genetic testing and consults for the potential to pass on to future children is already helping in terms of understanding his case. This diagnosis would affect the entire family because Lee's mother, Grace, may have some mental and emotional distraught from the gene being passed down through her side of the family, and that her son Lee has some life-changing decisions to make in regards to having children. And also that Lee's siblings, Leah and Luke, may have the potential to carry this gene as well and be at the risk for developing cancer in the future. The best way to handle all the physical, mental, and social deficits the patient may be experiencing. So the nurse, I think, plays a crucial role in making sure that all aspects of the family, not just their physical health, is being monitored. So the second question is, are these biases that might prejudice the provider's evaluation of the patient's quality of life? So There are some biases within the case study, with the nurse being emotionally invested in Lee's family and informing the family about a non-FDA approved trial. That there was a pause on this due to not enough evidence to support the treatment working. This is against the scope of practice of a nurse because you're making treatment recommendations that are not first recommended by the doctor. And they're also not being followed by evidence-based practice since they're not FDA approved. So I believe that this was completely inappropriate of the nurse to do, regardless of having good intentions to help the family. It's like letting your emotional opinions overtake your scope of practice as a healthcare professional. And the third question is, what ethical issues arise concern involving or enhancing a patient's quality of life? So ethical issues within this, I think it's pretty layered, but we talked a lot about the nurse being out of her scope of practice, making recommendations to this family for false hope that there could be treatment for this rare type of gene mutation when it hasn't been FDA approved. There's not enough research and evidence, and the nurse did know that this trial had stopped due to there not being enough evidence that the treatment was effective. And then also the ethical issue of, Lee wanting to start a family in the future and passing this genetic mutation down, knowing that it could cause cancer within another generation of his family. Okay, so the contextual features for the principles of justice and fairness. The first question is, are there professionals, interprofessional, or business interests that might create conflicts of interest in the clinical treatment of patients? So the conflict of interest in the clinical treatment of patients, I believe, is that the nurse was displaying countertransference and was emotionally involved with Lee's family, which ultimately caused her to go out of her scope of practice and offer a non-FDA approved clinical trial to Lee and his family. She offered advice on treatment, which again, I mean, this is reiterated, but completely out of her scope of practice. And these were not part of the doctor's plans. And it created conflict of interest because she's creating false hope for the patients that they're going to have a cure to this genetic condition. So the second question is, are there considerations of clinical research and education that might affect clinical decisions? So the consideration of clinical research, the nurse suggests to Lee and his family about non-FDA approved trial with the TP53 gene. The family gets, again, false hope that they're going to have a cure to this inherited gene, which they bring up to the doctor. And this wasn't part of the treatment plan. And although, like, again, the nurse was trying to help, she did not do it in a professional way. And this violated her scope of practice. And although also the decision to go along with the genetic testing for Lee allowed him to see if he is likely to pass along the inherited gene to his future children, which would be very likely to develop cancer. And now this decision Grace needs to make for both herself to see if she has inherited the gene, and also if her two other children do as well. So the third question is, are there conflicts of interest within institutions like hospitals that may affect clinical decision and patient welfare? So not the entire case study was a conflict of interest. I just believe that the nurse giving Lee, his family, that treatment option that was non-FDA approved was a conflict of interest. And like I said, it's against the scope of practice of the nurse, but ultimately too, the hospital does also have policies that are put in place for our scope of practice that can also limit what we're allowed to do in states. And this is not something, again, that the doctor previously spoke about. This could also affect the family's welfare in terms of false information about gene mutation and thinking that it can be cured and not going along with the treatment options or genetic testing that the doctor was recommending. Okay. So my perspective really didn't change. So the original perspective, the nurse should not have offered information to Lee and his family about a non-FDA approved trial to cure the TP53 gene mutation, and stayed within her scope of practice and not allowed her emotions to take over. And the alternative perspective, I guess you could say, is that the nurse was trying to learn more about inherited cancers and the gene mutation that could cause cancer to grow. and had the best intentions for the patients in mind. However, I still agree that the nurse was too emotionally involved with the family and created a conflict of interest that completely went against her scope of practice. So 2 of the codes I chose and how they relate to this case study. So the first one was provisions 4. And this states that the nurse has the authority, accountability, and responsibility for nursing practice to make decisions and take action consistent with the obligation to promote health and to provide optimal care. So within provisions 4, more specifically provisions 4.2, it talks about accountability for nursing judgment, decisions, and actions. So it says that the nurse must adhere to the standards of practice, scope of practice while practicing beneficence, loyalty, respect, and dignity. And we are, as nurses, accountable for decision-making and actions taken within the scope of practice of a nurse. So I related this to the case study because the nurse does not stay within her scope of practice. She offers a treatment option that's non-FDA approved, not part of the doctor's plan, and makes decisions on her own to go ahead and try to help this family. And this goes against this code of ethics from the ANA. And as future nurses, I think it's super important for us to be aware of our scope of practice within our state and our institution, so we don't also make any mistakes with helping our patients. And then I chose provision 7, which is the nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standards and development, and the generation of both nursing and health policy. So within provision 7, I focused on provision 7.1, which is contributions through research and scholarly inquiry. So this provision speaks to nurses must engage their knowledge and practice through evidence-based research and must comply with the international standards of research conduction. And they also must commit themselves to their patients through the continuum of care through research. And I chose this provision because I think that the new nurse in this case study does decide to research the TP53 gene for Lee's family, which is great. She's eager. She wants to learn about this genetic mutation that she's working on with this family. But then, goes and recommends a non-FDA approved trial to the family as a treatment option, which, is not showing any evidence-based research, although this is, still in the works. It's not approved because it doesn't have enough evidence to support it. So this completely, I think, goes against this provisions. So my personal reflection and takeaway. So I found this case study to be very interesting. I do feel that when we talk about ethical dilemmas, we don't always think necessarily of cancer and genomics is the first thing. But I do feel that the doctor and nurse had the best interests for the patients in mind and wanted to do anything they could to help them. I do not think, however, that the nurse went about it the right way. I think that her inexperience working as a nurse, she was a new grad, made her passion for wanting to help others take over. And this caused her to overstep her scope of practice by recommending treatment options that were not appropriate. The case study did not mention if the doctor decides to have any disciplinary actions or have the nurse to stop working with the family. But it makes me wonder if the nurse should have been asked to stop working with the family due to the over emotional capacity she had with the family. All right, so there's some discussion questions. Before we go into those, I'm just going to quickly go through, there's a couple let's apply it. They were questions for me. So the first one is an oncology nurse talked at length about her frustrations and moral distress in having trouble providing adequate pain relief to her patients. She said she only has half the painkiller she needs each shift, but knowing that she will need to do what is morally and ethically right for her patients despite her feelings. Here's an excerpt from her internal conflict. Do I give them to the younger one? Do I give them to the younger ones who might live longer, or the silent, suffering old ones who have worked their lives for us? She asked. It just isn't fair. I know who sells the hospital drugs, sells them, but if I complain about him and report his behavior, I may not have a job tomorrow. So I feel like the wording on this was a little confusing, but the way I took this was that the nurse is feeling like she doesn't have enough pain medication, and who is she supposed to give it to? Is she supposed to give it to one over the other? Which one should she do? So it made me think about how we're always supposed to do right by the patient, and having to choose one patient over the other goes against beneficence. And ethically, I think that she should report the person who sells the hospital drugs, regardless of the outcome of having a job with the charge nurse or HR. Why? Because as a nurse, you must always do what's best for the patient. And by doing right for the patient is being a patient advocate. And I don't think that you should be choosing one patient over the other. I don't think any patient is less deserving of a pain med than the other. And the unethical answer would be that choosing one patient to give the medication to and not the other, just because you're short of medication and you're afraid of losing your job. So you have two patients who both deserve the same level of care. And deciding which to deserve the medication over is not ethical, and it's not performing beneficence. Okay, so the second question was, you are working the night shift on an oncology floor and your 45-year-old patient suddenly goes into cardiac arrest and dies just hours after the doctor said she would recover well from her lung tumor resection. The organ procurement team arrives just as the family arrives, and you have very little time to discuss options with her family. They state that her loved one was an organ donor and they are aware of the time constraints. However, the surgeon notes that the patient's medical chart that there was a possibility that the cancer has spread to a nearby organ, and further diagnostic testing needs to be done. The surgeon has not had a chance to discuss the possibility of metastatic cancer yet with the family. So unethical and ethical approach by the nurse. So I said, ethically, you would speak to the doctor about the plan of care, the next steps, work with the doctor on communicating to the family about the metastatic cancer and the possibility of the cancer spreading to the other organs, and the need to get the results before deciding if the organ can be donated or not. And regardless of the time being a factor with the organ donation, the confirmation of the cancer of being metastasized is the most important factor, because just giving an organ because it's due for an organ donation without confirming if there's a cancer diagnosis or spread, I don't think is ethical. And the unethical part would be to ignore the metastatic cancer finding and the need for further testing on the organ to see if the cancer has spread, and going ahead with the organ donation without telling the family about any of this and speaking with the doctor. And I was just thinking this kind of relates to the provisions too in the code of ethics, that the nurse's primary commitment is to the patient, whether the individual, family, or the group of community. And we have to be that patient advocate. And I'm just going to show quickly my references and my contact information. All right, so we have a few discussion questions. So the first one is, as a nurse, what is your scope of practice for researching genetic conditions and presenting to the family and or healthcare professionals? So I know that we may not know that, so I can kind of start us off here. Through my research, nurses are able to gather family history, identify hereditary risks, and make appropriate referrals to genetic consultations and testing. But they are not able to recommend treatment options or recommend things that the doctor hasn't put within the plan of care. So I don't know if you guys have any thoughts on that question at all.
I mean, it kind of just seems like she just went above and beyond
Yeah.
just because she had an interest in the family. Yeah, because that's just like not in the scope of practice at all.
Yeah, exactly.
Do we know why she had such an interest in the family in the first place? Or it was just because it was her patient?
Yeah, it didn't say. My thought from reading it was she's a new grad nurse. You know, this is a very interesting case. Maybe she had interest in oncology prior, and it just motivated her to like learn more. But it didn't say anything specifically. But she, for some reason, gained an emotional attachment to them.
Yeah.
Some of this kind of gives me like the same type of energy or type of thinking as like when COVID was really big and people were trying to distribute like the vaccines to everybody. And then a lot of nurses were kind of doing their own research and like
That's a good
giving people
answer.
ideas as to like what they should do medically, even though they might not have been like research assistants or like people who are like actually in the know about that stuff. So I totally, yeah, think she was out of her scope for sure.
Yeah. I mean, and I get she seemed eager to help, but it's kind of like that like emotional connection versus, is this what I'm supposed to be doing as a healthcare professional for the family?
This kind of like goes into the next one.
Yeah.
But
So
like,
yeah, we can talk about the second one. So that one says, did the nurse overstep any professional and or personal boundaries with this patient, family, and or doctor?
so like I say, obviously, yes, like she could have done other things. Like, I don't know why instead of talking to the patient first, like why didn't she bring what she knew like to the doctor first, just to see if this was even like a thing or an option? Because
Yeah.
if she had done that, then like that, I feel like that would have been the right thing to do. Like the ethical thing to do would be to talk to his actual doctor first before going to the patient. So I think she definitely overstepped. Like,
Yeah, absolutely.
Yeah, I agree with Robbie. I feel like her like emotional, like whatever connection she had to this patient and the family kind of clouded her professional judgment of like what the boundary should have been in
Mhm.
this instance. So I feel like, yeah, I feel like her judgment was a little clouded.
Yeah, definitely. All right. So the next question is, how does a person's coping mechanisms and or personality play into this ethical dilemma?
I guess you could say the coping mechanisms play in slash personality from like the nurse's perspective as to like if you're feeling helpless with your patient and you're like, oh, these are really good people and this is just such a poor outcome. I feel so bad for them.
Mhm.
It's kind of like a way to explain things for yourself maybe and be like, well, there is research being done, and like it's kind of her way of like maybe justifying or thinking of some possible happy outcome for these people, but it's just completely inappropriate because it's not valid information.
Yeah, exactly. There was even one of the readings in the module this week talking about just like, nursing care with oncology and how it can be, very fatiguing and upsetting because sometimes the outcomes aren't what you are going to want. And those are some tough conversations to have with families, but it was, talking about minding your boundaries as a healthcare professional. And, there may not be a right answer for what the treatment option is because there may not be one, but like you said, Jacob, like, offering something that's not a solution is, I think it might harm them more,
Yeah.
false hope. So,
I also think that sometimes like maybe you feel awkward when you don't have anything to say. Like
yeah.
if you spend a lot of time with this patient and the family and you really like them, and then they find out this news, and then it's just like, okay, like I can't do anything about this. Like maybe like because of her personality, she just really just wanted to do something, and maybe that was her way of coping too. Just like
Yeah.
not having nothing to say. Like something was better than nothing. Still wrong, but
Yeah, that's very true. Like I was even thinking at clinical today, my nurse I was working with said, when I first became a nurse, I was always wanting an answer for my patients. And the biggest adjustment was knowing that there's not always going to be an answer today, or maybe there may not always be an answer or a solution. So I totally agree with that.
yeah.
All right. So does the nurse have any professional and or personal biases? I mean, we kind of
Yeah, she has the personal bias towards the family because she built such a strong connection with them.
Yep. So then that obviously is like crossing professional boundaries.
Mhm.
Yeah, it made me wonder, like, I mean, I'm not saying that a more experienced nurse can't cross those boundaries, but I was wondering if it had anything to do with just her inexperience with nursing care. And this kind of being like her first job as a nurse and maybe, not being able to emotionally in a mature way handle this.
Maybe she just didn't know, like she
Yeah.
wasn't familiar with the scope of
Yeah.
practice in general. Like I feel like she was just naive and like I
Mhm.
think that plays into being a new nurse.
Yeah, that's why I was making me think like it's really important for like us when we're going to be new nurses soon to really like know our scope of practice in the state we're in and the hospital we're working at.
Yeah, and I feel like especially with oncology, like you develop such a relationship with your patients where it's just like such a I feel like it's one of those professions that like you usually don't have that kind of relationship with someone. So I feel like especially as a new nurse, it's probably hard to like know where the boundaries are and like where you're helping or like where you're not supposed to say something or where you are supposed to say something. So I imagine like just playing devil's advocate that it's probably so hard and like overwhelming and easy to get like clouded judgment wise, but it is a good reminder like as new nurses to always like remind yourself to take a step back and like check with the doctor, check with someone else before you're gonna go in and like say something like this was so important that this was like such a big thing that she decided to say to
Yeah,
them. So I feel like just like it's a good reminder to always check in with someone.
definitely I agree. All right, so last question, does Dr. Aiken within scope of practice Okay, was Dr. Aiken within the scope of practice or did she step out of her boundaries at any point?
Um, I feel like she was definitely within her scope of practice. One of the specifics that I caught on to was the fact that she um the way you explained it sounded like she did a really good job at providing like a good amount of education to the parents and letting them decide what they wanted to do and like keeping that sense of autonomy with the patient and the family um especially compared to the last case study that we talked about. I feel like it was like it showed how ethical and like good this doctor was.
Yeah, I agree.
Yeah, I don't see it. Like literally this case is just about this one nurse to me. Like there's nothing else that was like out
Yeah.
of place.
The only thing, and I didn't think it talked enough about it, was I know it said the doctor was on like cutting edge research for like the ACC testing, but it
Mhm.
seemed like that just helped the family more than anything because it picked up on the genetic testing for the gene mutation versus
Mhm.
that being not a treatment option and the doctor thinking it was a good idea. Yeah, I agree. I think it was mostly just the nurse.
Mhm.
All right. Do you guys have any other comments or anything?
Mm.
Okay.
Mm-mm.
All right, I'm gonna stop sharing. And I'm gonna stop recording.